With so much happening over the past couple of weeks, health officials want people to practice safe social distancing. We talked with Bethesda Hospital critical care nurse Emily Allen about the trends with COVID-19 and what we can expect moving forward. Talking a little bit about reopening, but then also seeing people getting together with protests and other things going on. You wanted to emphasize that people continue to try and social distance and wear a mask. Talk about that in a little bit.
I would like to say that I hope people do better than try. We still need to continue doing the social distancing, keep wearing masks. You still need to keep washing your hands. I wish I could say that summer was going to take away COVID, but that's not the case. This isn't going away anytime soon.
And we heard state health officials talk about this in Minnesota right now as plateauing, but with the protests and with some of the reopenings, do you expect that to continue? I suppose nothing's for sure, right?
Right. We would love to say that we have a crystal ball and yes, this is the final stages of it. But, as the weather's getting nicer, as more groups are gathering, the risk for this highly contagious virus to be caught by people is going to go back up.
Good. Do you think the warm weather, we've heard that over time, maybe will help here, or is that we just don't know enough yet?
I don't think we know enough yet. There's still things that we're learning about COVID and the virus every single day. New developments, new possible treatments, and I just think it's too soon to know for sure if the weather will play a major factor.
As a critical care nurse, we're still seeing a lot of people, congregate care, and we saw the food processing plants. They're really at risk here in a lot of cases, and older folks. But we had somebody in Ramsey County who was in their 20s and really, from what we understand so far, didn't have a lot of underlying health conditions. Should people in their 20s be mindful, be wary of that? I mean, we don't know if that's something that we're going to see widespread, but obviously it's a concern, correct?
This virus does not target one specific age range. We've had patients on ventilators in their 20s and we've had patients on ventilators in their 90s. So it does not discriminate any specific age group. And yeah, it can be spread to any number of people. I mean, I've even heard of cases of children in other states, young children. So yes, it's definitely a possibility for younger people in their 20s to contract it.
What are you seeing at Bethesda? Are things calming down a little bit right now as well? Speaking of our previous question about things plateauing, what are you seeing at Bethesda?
It is, we are starting to have some more beds available and open. But I know, speaking for myself, the doctors, the respiratory therapists, all the other frontline workers, we kind of think it's another calm before the storm. Like when we first started shutting things down and really started to be cognizant of COVID's coming and we need to kind of come up with a plan. So if we do get another spike again, we are a well-oiled machine at Bethesda. We are working really hard and we feel like we've got the best treatment plans and staff to take care of these patients. So we're ready if it happens again.
Good. And we're talking about now looking ahead, we got summer vacation now. Last week of school for a lot of students last week. But already parents are thinking about, I know I am, about the fall.
Yeah.
Will kids be able to go back? The University of Minnesota says that they're hoping to have a reopening in the fall for students already. We haven't heard from a lot of school districts in the state, or not too many yet, but too early to tell? I suppose some of those decisions will have to happen though in the next few weeks, right? Or next month or so?
Yeah, I think it's hard to, for the teachers to prepare for exactly what's going to happen, and the other, the school districts, the principals, those types of people, because we just don't know yet. It's so unpredictable. The surges and the influxes with COVID, I think it's too soon to tell.
And everybody's hoping for a vaccine is the end all here. But again, like so many things we talked about here, that also is up in the air right now.
Right. I wish that we had a vaccine months ago before things got really bad like they have been. But I think a lot of us are, the people that have been working extra hours and mentally and physically exhausted. This plateau, quote unquote, has been kind of a nice break for all of us to refocus our energy and compassion, and we're still ready to go back out there and fight. So yeah.
Great. Well, thank you very much, Emily. We appreciate it this morning.
Thank you guys so much. Have a good day.